All right, so everybody should see the presentation now. So our topic for today is going to be covering health monitoring tools. So using a variety of devices to keep track of your health. I aim to talk about a variety of devices, both from a budget and a technical complexity standpoint. So hopefully there will be something in here that is useful and applicable to you. If not, I'm also more than happy to discuss other options afterwards as well. All right, and I just want to mention quickly that this program is funded by RBC, the Government of Canada, the Government of Ontario, and Entente Education, which allows us to run presentations like this around the community for survivors of brain injury and seniors as well. So there's a variety of different types of health monitoring tools, and you can keep an eye on your health in a variety of different ways. So there's really a lot of options out there, and I'll do my best in this presentation to give you a broad overview of what's out there. The first type, and I think this is, at least for me, the one that comes to mind when I think about health monitoring, are wearable devices. These are usually things like watches, like what I have, and more recently now there are rings. These can be different brands like Fitbit, Apple Watch, Samsung Watch, and so on, which you wear throughout the day and provide you insights into a variety of different metrics on your health. So we'll talk a little bit about those. There are also apps on your phone that you can get that will also keep track of your health. They'll use it through your phone. So just if you have your phone on you, that can keep track of stuff. But those apps also serve as kind of a one-stop place for all of the information. So you can have that app collect all the information and keep it in one place for easier access. Smart home devices like the Amazon Echoes or Alexas that we are giving out, or Google Nest Hubs, as well as some other brands, are very, very useful for coordinating some of this stuff so they can keep track of some of the data that's on your phone as well as on your watches. We also see a lot of specialized medical devices like blood pressure cuffs or glucose monitors, which are becoming more and more technologically advanced and can provide, in addition to the regular features, some extra ones that maybe can give you a bit more insights into your health, or which can make them a little bit easier to use. And finally, there is also the potential for using AI in a number of different ways. This is either by talking to AI directly about your health, or that certain devices have AI features enabled now. And this looks different for every device, but it's just becoming a more and more popular feature. So I'm going to talk about all of those different metrics that you can measure with these devices. And I want to start off with step and activity tracking. And I have here it split into more basic and more advanced tools. So if you would like to know how many steps you take a day or how active you're being in general, a wearable device or something you keep on you is generally going to be the way to do this. The most basic way to do it is with a very simple, almost analog pedometer, which is just a little device that you can clip on to your belt, and it'll track the number of steps based on your movement. So you can just wear this on you, and you can see it'll often have a very big dial like the one I have in the picture, and it will show you an estimate of how many steps you've taken that day. I say estimate because it can't really know 100% accurately how many steps you take, but based on the movement of your body as you take a step, it uses that as a proxy for that movement. A lot of phones will have this functionality built in. So phones will have often a fitness app. So I have a Samsung, so I have Samsung Fitness. I'm sure there's Apple versions as well. And these will log your steps automatically as well. Sometimes you might have to open the app at least once for it to open up and give you all the information that you have to agree to before it starts tracking. But for a lot of you, it might have already been doing that in the background without you realizing. And so at the end of the day, if you keep your phone on you, it'll count how many steps you took while your phone was with you. More advanced tools are generally going to be smart watches. I have here pictures of what the Apple Watch looks like and the different screens that it can show you. These will often use the movement of your arm to track steps, but also probably some sort of input from it feeling you hit the ground when you take a step. And so these have a a multitude of different features that they can do, but one of them is step tracking. So they can track the number of steps, but they can also track activity. So they have a sensor that can tell if your heart rate is raised, which I'll talk about heart rate in a few minutes. But they can tell that you're engaging in some sort of activity. If you're playing a sport or you're maybe speed walking or jogging or doing anything that raises your heart rate, it can automatically detect that a lot of the time and ask you if you're doing a workout, which you can then record on your own. I wanted to mention quickly for anybody who uses a walker, just to keep in mind that sometimes your watch may not give you a very accurate step count if you were holding a walker as you move, since then you're not getting that swinging of the arm. So in that case, maybe something you keep in your pocket might be a little bit more accurate. So a phone or a simple pedometer might be better for you and will give you a better estimate of how many steps you've taken. For activity level, it'll still measure how active you're being based on your heart rate. All right. So this leads us into heart health monitors. So a very simple one, of course, would be something like a blood pressure cuff, which will often also give you your heart rate. A digital one will. It'll give you your heart rate. A more manual one will just give you your blood pressure. But again, I just want to show you that there's a variety of options now. So you can always go for the very, very simple manual one with the hand pump, and that's totally fine. But if you want something a little bit more advanced, there are digital blood pressure cuffs available now, which will, as I said, show you your heart rate in addition to your blood pressure. And some of these can even connect to your phone. So, for example, this is useful if you want to keep a running log of your heart rate over a longer period of time. Your phone will record the time and date of when you measured your blood pressure and what your blood pressure was. And it'll keep an archive of these going through time so that if you go to your doctor, you can show them that in the past month, this has been your average blood pressure. And then maybe they can look at patterns of, time of day or diet or other factors that may influence your heart rate. So it's one of those features that can be very, very useful for people who would like to collect some of this data, and who are curious about how their health metrics change over time. So, as I mentioned, wearable devices can also measure some of your heart health. And the technology can't currently measure blood pressure. Some watches may have a blood pressure feature, but that is just somewhere where you can record it. It doesn't usually measure it on its own, but they can measure your heart rate. So, a lot of ones will have either you can manually select it. So, if you go through the options on your watch, you can select measure heart rate, or some of them have it where they do it automatically at certain intervals of time. You can have it do it once an hour, once every 5 minutes, or any time in between. And so these can give you an idea of what your heart rate is like throughout the day. And you can match this to certain activity levels to make sure that you're getting a good heart rate. If you are trying to do some sort of exercise where your heart rate is at least a little bit elevated from resting, this is a good metric to see when that is. But it's also helpful if your doctor has warned you about not going past a certain heart rate. So if it is dangerous for you to be above, let's say 150 beats per minute, that can be a useful tool to see when you are overexerting yourself and when it's maybe time to dial things back a little bit. Some of these watches I've heard can also detect irregularities. So if they detect arrhythmias or anything like that, they may warn you. And I just want to mention here, and I'm probably going to repeat this throughout the talk, but a lot of these things which offer medical insights are best guesses. They are not medical grade devices most of the time. They're just technology that can sort of measure it in a pretty reliable way. So if you ever get a warning about your heart health from your watch, I wouldn't take this as a 100% sign that there is something wrong. I would instead use it as a potential warning and something I would then talk to my doctor about. So you might get a message on your watch, but that is no reason to panic. That is just something that, it might have detected that really is there, or it might have just been a bad connection for a few seconds if it couldn't detect your heart rate, which it misinterpreted as an arrhythmia or some other anomaly. So just a note there about those irregularities. And so there are also rings now that are out there. So this is kind of like a smartwatch that you wear on your wrist, but whoops, and I just turned something on my watch there. But they go on your finger and they are, I've heard, not as good quality for measuring some of these things. So there's not as much data that you can get out of your finger as your wrist. And just all the components have to be much, much smaller, of course, to fit into a ring. So I think they're good for the convenience of it, but they may not offer as good of an insight as a watch does if you're curious about some of these health pieces of health information. Sleep tracking is another pretty neat thing that you can do with some of these devices. And these are going to be wearable devices, so the watches or the rings. But a lot of them will have sleep tracking capabilities. So it means having to wear the device at night. And so this is where maybe a ring might be more beneficial than a watch since it's a little bit less obstructive. Most of us might be used to going to bed with a ring on, but not with a watch on. However, I've tried it a few times and I've gotten quite used to it. I don't wear it every night, but if I ever do want to look at my sleep stats, I wear it and it doesn't cause me too much discomfort. So it's not a huge issue there. But with sleep tracking, your watch can give you insights starting off with when you fall asleep and when you wake up. So I'm not sure what exact things it looks for, but probably your movement, your breathing, and your heart rate. And so it does its best guess of when you've fallen asleep. And then when you wake up and you start moving around and maybe even using your watch, it'll know that you've woken up. Then it'll stop the sleep tracking. And some watches can even give you more detailed information about your sleep, such as the sleep phases you go through, their length, and then the quality of sleep. So I have on the left a little screenshot of an Apple Watch and its sleep report, and so you can see here that it's broken down the sleep into the different phases. So you can see from left to right is the period of night. So this person went to bed, I think around maybe 10 p.m. and then they woke up probably around 7:30 a.m. And so it'll give you, so it said, they got about 8 hours and 45 minutes of sleep. And it shows those red ones, the red phases are when they were awake. The sort of light, I think it's a light blue, I can't really tell, is REM sleep, which is usually when you dream. It's when your eyes are moving around. So it's called rapid eye movement sleep. The darker blue is here it says core. I think this is light sleep. So this person got quite a lot of light sleep. And then those very bottom ones, the dark color is when the person was in deep sleep. And so this can give you an idea of approximately how much time you spend in each phase as well as how good of a quality sleep you get out of all those phases. So, for example, I would expect that the person, when they would look at their sleep report, whoever's sleep this was, would get quite a bad score since they spent very little time in deep sleep. And deep sleep is when we go through a lot of that deep rest that we need throughout the night. And so light sleep, there might have been some sort of issue there. Again, this is the watch's best guess of what your sleep phase was. You actually need brain scanners and brain signals to be able to fully detect sleep phases. So this is sort of a best guess, and it may not be fully accurate. So again, if you're seeing this and you're worrying that your sleep is very bad, you might want to get that checked, but it might not be a 100% sign. This is useful for if you just want to see maybe, um, you know, if you're waking up and you're feeling quite tired, is it because of a lack of sleep or is it because of poor quality sleep? It's also interesting to see those little awake phases throughout the night. A lot of people do wake up in the middle of the night but don't realize it. So they may be fully conscious when they're awake, but they fall asleep so quickly that they never remember waking up during the night after they wake up fully in the morning. So it's quite neat to see this. And I've had it where I've seen my watch log my wake up time as being exactly the same time my alarm went off. So it's nice to see the confirmation to know that it is quite accurate. And again, as usual, this is stored on your device, and often it'll be stored on your phone as well. So you can pull this up on your phone if you go to a doctor, for example, to show them how your sleep has been. Okay, I want to talk also a little bit about tracking food and nutrition. Um, this is useful for a number of different reasons, but I see especially with seniors that there are often certain nutritional goals that you might have to achieve given to you either by your doctor or just something you might have as a personal goal. When people think of food diaries, they often think of maybe limiting their food intake or eating less. If this is something that you think you need to look at, then that's fine. But food diaries can do a lot more than just that, and they can give you a really good breakdown of what you're eating and how that looks. And I want to mostly talk about a certain app called MyFitnessPal, which is a digital food diary. This is something I use and have used for a number of years, and it's very useful for me to keep track of my nutrition. And so the idea behind MyFitnessPal is that as you have a meal, you can log in its database the sort of food that you're eating. So if you have a stir fry with rice, you can write down the amount of rice that you had, the vegetables in your stir fry, the meat in your stir fry, and then very importantly, the sauces that you added to it. And if you log very carefully, it'll give you very accurate amounts of calories, nutrients, and a breakdown of all the nutrients that you're getting from your food. And it has a built-in database. So it knows, for example, if you put in 1 cup of white rice, it'll know all of the nutrient facts for that type of rice. And it can get very, very specific. I don't know if this is a free feature anymore. It was when I first got this app, but if you're eating any sort of food that you bought from the store that has a barcode, so usually industrially produced food, or ingredients. If you scan the barcode, it'll give you the nutrition facts for that exact product. So it is just going to be whatever is on the nutrition facts label that has been inputted into this database. So it can be very, very accurate as long as your estimates of how much of that food you had are accurate. And so then at the end of the day, it can show you how much of your nutrients, of your goal, you've achieved. So, for example, if you are trying to eat more protein, you can at the end of the day look and see how much of your calories that day came from protein. And maybe you have to have a little bit more or have a little bit less. If you're trying to have more of a certain vitamin, then you can look at which foods are higher in a particular vitamin and then make sure to incorporate those a little bit more into your diet. And I think the best benefit of keeping a food diary is really just being more mindful of the things that you eat. So, if you're thinking about making healthy choices, it might be easier to see in front of you and to look at, do I want, when I'm deciding what to have as my lunch, it might be easier when you have the data in front of you to make a healthier choice or a choice that is better, for your nutrition goals, whatever they may be. And you can also adjust these goals as needed. So if your doctor has told you that you need to, let's say, limit your sodium intake below a certain threshold, you can set that threshold in the app and then make sure that you are staying below that amount. And you can check on it throughout the day. So this is a very, very neat tool, and I think a very, very useful thing. I think the one downside with this is that it can be a little bit tedious for a lot of people. It is a lot to have to write down all the things we eat after every meal. So for that, I recommend either for some people, it's easier just to do it as you go along, or if you can remember what you ate that day very well, to do it at the end of the day. And it's ultimately better to make a best guess and an estimate of how much you ate if you can't get the exact number right. But if you are interested in logging your food, but this is, you think, a little bit too much for you to do, there are also now AI-powered photo diary apps. I can't remember the name, unfortunately, of the app, but there are a number of ones out there. If you just search AI food diary, you can find a number of these. And the way that they work is you take a picture of your food and it scans it and then inputs all the ingredients for what you ate. This is very good for quickly logging things. If you don't have the time to manually put everything in, this is you just take a picture and it logs everything in. The problem with this is that it's going to be much less accurate than if you do it yourself. Again, this AI app is going to make a guess based on what's in your meal, but a lot of ingredients are invisible. So it's, for example, not going to know how much salt you put in. It's going to guess based on what it thinks is a normal amount, but you might be someone who likes their food more salty or less salty, and so it's not going to really know. You might be able to adjust afterwards, but if you're really going for that quick convenience scan, you're going to do that at the cost of accuracy. All right. I want to also talk about some brain health tools. So there are a variety of brain health apps out there. And I split these into two different types, and I want to split them because it's important to know the differences between the two, and I want to talk about them separately. The first type of app is one that often involves you playing some sort of brain games, and it'll be just basic games that involve numbers or letters, which claim to improve brain function. Now, I'm going to mention this at the beginning, and I have a little asterisk beside claim to improve brain function. And it's that a lot of them will say that by using this app, you can expect to see, huge improvements in your memory or your cognition or your language or any number of other benefits. I want to make it very clear that unfortunately, there is not a lot of research that supports some of these claims. There's no harm in using these. They're fun games and they can be a nice way to pause and to do something nice. And oftentimes they're very, very well designed and nice apps. But I just want to warn anybody here that, sometimes they may make you expect to see a huge change. And so I want you not to be too discouraged if you were using this app and not seeing any changes to any cognitive functions that you were looking for. You may see it, and if you do, that's great. But I just want to make sure that for those of you who may use it and not see it, not to be too discouraged, but also not to worry that there isn't really any harm in doing this. They're usually quite fun. The three most popular ones, or at least the ones I've heard of the most, are Lumosity, Elevate, and Peak. They're all a little bit different, but the main idea really is that you just log on, usually every day, and it'll give you some sort of games that you can play. And they will often target a variety of different functions. They may claim to improve memory, language use, your vocabulary, pattern recognition, multitasking, all that kind of stuff. And so they can be quite fun games to practice, and you may see improvements in certain things. So those can be quite neat. And oftentimes they can also be tailored specifically to you. So I think for Elevate and probably the other ones too, it will ask you what sorts of things you want to work on, and then tailor the games that it gives you based on your goals. The other type of app that is out there focus more on improving mental health through a variety of activities. And so the apps for this that I hear about the most are Headspace, Calm, and Happify. And these focus on guiding you through mindfulness or meditation activities that can help you take a break sometimes if there's a lot going on, to just take a deep breath, meditate for a little bit, think about what's going on, and to deal with the things you're experiencing as they come in. I'm not too sure about the maybe clinical benefits of these, but I think it's useful for most people to have time in their day where you pause, you stop to think about how you're doing, and you be a little bit more mindful of the emotions you're experiencing. And this is, I think, quite beneficial for most people. So if that's something you'd like to try out, I would recommend trying out at least one of these apps and seeing how it works for you after a certain period of time. One thing I think is very important for seniors, especially, is communication and emergency tools brought by a lot of health monitoring and other devices. So the most basic for these would be medical alert devices. So again, the most basic is things like a life alert bracelet or a medical alert. I think there was a brand as well called that. So this is that picture I have at the top left there. It's just a simple bracelet, and sometimes it's also worn as a pendant on a necklace, where it's just looks like a little remote, and it just has one button on it. And if you are ever in distress, you press this button and it will contact emergency services for you. So these have been around for quite a while, and for good reason. They're very, very useful, and they are popular since they help you stay connected to emergency services if you need. Nowadays, smartwatches also have this feature built in where you can use your watch to make an emergency call. And so this is convenient since you might have your watch on you, but not your phone. I think especially the benefit with both of these, and so for both newer Life Alert bracelets and for certain models of smartwatches, they will have fall detection built in. So if you happen to fall down, they will often detect that there's been some sort of hit or bump against the device, and it'll give you this prompt to ask if you need assistance. And I think what a lot of devices will do is they will prompt you to see if you're okay, and they will wait for you to reply that you are okay. And if they don't get a reply, they will then contact emergency services, or you can do it manually. But the idea here is if you fall and you're unable to swipe on your device or you're unconscious, then if they don't get a reply, they will call emergency services for you. So I think if you are someone who is, if you're worried about falling and getting help, this is something to look out for. But I do want to mention that not all smartwatches will have automatic fall detection. So if this is something that you are interested in, I would make sure to look for that specifically and factor it in when choosing which watch you want to buy. Voice assistants are devices like Alexa, Google Assistant, and Siri. These are devices that you can talk to. And so you just usually use a phrase to activate them, such as Hey Google or Siri or Alexa, and then you ask for whatever it is. And apologize if I've activated anybody's smart home assistant at home. But you can tell them what you want and they will carry out that for you. These have a number of benefits, but in terms of health monitoring and health in general, the best is help in case of an emergency. So if you do not have a watch or it's not on you and your phone is not on you and you've fallen down or for any other reason need emergency help, you can't get to either of those devices, you can use your voice to get help. So you can have a voice command and ask for it to do something. Not all devices can call 911 directly. So I think Siri might be able to. I don't know about Alexa and Google. They might not be able to. What they can instead do is call an emergency contact for you. So you can call um, your child or a friend or a partner, and then they can make the emergency call for you. But these are extremely convenient because you can access them at a distance. So if you're immobile and you can't get to any of your devices, you can tell the smart home assistant to make that call for you, which is a very, very great benefit. So I recommend for people who are at risk of falling and for whom it can cause serious health effects to invest in some form of medical alert device like a bracelet or a smartwatch with that built in, as well as a voice assistant that you can then access in case you don't have your watch on you. And it's just having both of those as an extra layer of protection in case you do happen to have a fall. You can also have your voice assistant give you useful reminders. So if you have doctor's appointments coming up, or if you need a daily reminder to take medication, you can ask your voice assistant to do it, and it'll verbally tell you every day or leading up to an appointment that this is something coming up to remind you that you've got something on your radar. Certain devices now have AI integration that is emerging, and so they might have unusual pattern detection. I don't know much about this yet, but what I've heard is certain devices like watches will be able to detect if you are not getting up at your usual time and can then alert you or a loved one that, maybe you haven't gotten up when you usually do, and that there's maybe something worth checking out in case you're not feeling well or if there's something else going on. So many devices and services now incorporate AI features into them. So it's important to chat a little bit about this and how they factor into a lot of this technology that we see. And so AI is quite a complicated topic to explain in one sentence because it can take on a variety of different forms, and it's very broad in the number of things that it can do. But the most common example that I think is on most people's radar nowadays is things like ChatGPT, Gemini, and Copilot, which are AI assistants or chatbots. And so these are the ones that you can talk to answer questions or just to have a chat with that a lot of people do use on a daily basis. Some people use these to provide health recommendations. So they will ask ChatGPT for top tips on some sort of health topic. Um, for those of you who use it for this or are considering this, I would just be very careful in that AI does have a very broad range of knowledge and can often give you the correct answer, but it really lacks insight into your particular medical condition. It doesn't know what, all of your health information is and who you are as a person. And so it can't really give very personal advice unless you tell it. And that's another thing we'll talk about. But also in case anything goes wrong and AI gives you a piece of information that is wrong and you happen to harm yourself in any way or do anything contrary to what you should be doing to help yourself feel better, AI cannot be held responsible for this. So it's not like a doctor where, they're responsible for the tips they give you. AI is not the same. So I would be very, very wary of taking health advice from AI. So unless it's something like a cold and you just want some tips on how to make your throat less scratchy, I'd be very, very hesitant to get any sort of health advice from AI. What I have heard people do is they may upload their medical scans, and they have AI look it over and see if it can find anything that the doctor might have missed. And so this here is kind of a supplement to a doctor's visit. So it's almost like a second opinion. This might be good for just alerting you to certain things that you can then bring up with your doctor later, but it doesn't replace the doctor's visit on its own. My tip for this is that if you are uploading any of these scans or this is something you're curious about, make sure to remove any personal information. And so this goes for any sort of AI use, but just if you're using it, make sure not to share personal information. Things like your full name, your address, sensitive health information, and so on. Try to generalize when you can and be more vague to prevent you from sharing all of this information with an AI chatbot. AI, one of its strengths is that it has very good pattern recognition and so therefore personalization. So AI can remember information about you and use it so you can make it very personalized to you. So if you have certain conditions that you don't mind sharing with it, you can talk about those and then have it give personalized tips to you. So for example, if you are someone who, as I mentioned before, maybe needs to not have their heart rate go above a certain limit because it can be detrimental to your health, you might talk to ChatGPT about recommending certain exercises that have less of an impact on your heart rate. And so that's a very, very good use of AI in creating a workout plan that is personalized to you, that keeps your heart rate below whatever threshold you have to stay at. So just think about uses like this, where you can have it benefit your life and take into account your personal information without, giving it way too much. So some notes about privacy for using AI. Just be aware, and this is sorry for AI and also any other health devices, just be aware of what's being tracked. When you install a new app or go on a website, it will often ask your permission to use certain services, things like your contacts, your location, your call history, your camera, and so on. Just make sure that you aren't blindly agreeing to these, that you think about why you're agreeing to it. So, for example, when most of you installed Zoom for the first time, you would have been prompted with Zoom asking for permission to use your camera and mic. This makes sense. Zoom is a video calling app, so this is totally fine. But make sure if there's another app where it doesn't make as much sense for it to be using your camera and your mic, that you're a bit more cautious about agreeing to anything without thinking through it carefully. Only share data with people you trust. So if you are sharing any sort of sensitive health information, that you really only do it with medical professionals that you trust. And if you're sharing anything with AI, that you remove any confidential or sensitive information. If you're curious about using any of these devices and programs that I talk about or any other ones that I might have missed, please be very careful about it and read about those devices. So read about what sorts of benefits they have and see if it's a good fit for you. As I mentioned, but I think I can't mention too many times, when health is concerned, all of these tools that I talked about today provide advice and recommendations. They do not give official medical information or diagnoses, and so they definitely do not replace real doctor's visits. They can be good in assisting you with your health and helping you monitor certain things, but if you really want an official diagnosis and a proper medical scan, this is going to be at the doctor's office. So don't 100% trust the things that the devices tell you. And also, talking to your doctor is good if you want recommendations for certain devices. So your doctor may recommend a device that might be right for you based on whatever health circumstances you are in. So I have some tips on how to choose the right tool. The first is to start simple and then upgrade if you like it. If you are someone who is not too sure if this is something you want to use often, just start simple and then see how that is. And if it's something you like, you can upgrade it later. If you're confident that it's something you will use and you like, then you can go for a more advanced model right off the bat. Related to this is I would recommend to pick what matches your comfort level with technology. So if you're someone who is not very tech savvy, I would not recommend a very, very complicated watch since it can make you just be put off of from using it and you might just miss out on a lot of the features that it does have. And there's no reason for you really to have it. So if it's kind of overwhelming for you to be confronted with a lot of those features, look for simpler devices that have just the features that you're interested in. Also consider budget. A lot of these devices range in budget. So I talked about some simple ones, some more advanced ones. Even within smartwatches, they can range from $40 to over $1,000. So there's a huge range. So make sure that you're picking what's right in your budget and you don't always need the most advanced, most expensive device. Also consider support. Not all brands are as well known. So, for example, with an Apple Watch, Apple is everywhere and it'll be quite easy for you to get help with your Apple Watch. Versus if you buy a watch somewhere from Amazon, that's, again, like 40, $50, that isn't really from a reputable um, business, it may be harder to get support with it. So just keep that in mind. And the last thing is, if you want advice, talk to others and read reviews. So if you aren't sure which device to use, go online, read some reviews, see what people say, and also maybe talk to other people you know who might have the device and can give you some tips. One last thing I want to talk about is just a little look at the future of health monitoring. These are some speculative things that maybe we'll see in the future. AI and technology are very rapidly advancing, so we can see a lot of these changes potentially in the near future. And it's just always fun to keep an eye out for various innovations and improvements. Some things that we might see in the future is AI that predicts health issues before symptoms appear. So AI is very good at tracking symptoms and noticing patterns. So I recommend this for a lot of people to use AI as a kind of symptom diary. And you can talk to it about what symptoms you're feeling at a certain day. And so right now it can do a very good job of logging these things, but maybe one day it can start predicting certain health issues that you can then bring to your doctor and catch them much earlier than you would have otherwise caught them. We might see wearable devices that can monitor more data. For example, maybe levels of hydration through how hydrated your skin is, or stress measures. My watch measures stress, but I don't know how accurate it is. So we might see more accurate measures of stress. Hopefully, we can see more affordability and ease of use. So the price has come down quite a lot for a lot of these smart devices. As I mentioned, you can get a smartwatch for 40 or $50. As well as ease of use. So devices that are catered more to seniors or those who aren't as comfortable with technology. And then finally, general improvements in pattern tracking and personalization that make them even more specific to users. So quick recap of what we talked about today. There are many, many different ways to monitor your health, and these different ways vary in a lot of different ways. So they vary in complexity. They can be quite simple or more complex. They don't all measure the same things. So if there is a particular stat you're interested in, make sure your device can measure it. Some of them will have AI integration, some of them might not. A lot of these devices will also vary in budget quite a lot. They may be low or high tech. So as I mentioned, you can get a very simple blood pressure cuff, or you can get one that connects to your phone and has all the bells and whistles added onto it. And then also related to budget, there's also quality concerns. So just make sure that you are maintaining a good balance between budget and quality so that you get a good quality device for your money. Make sure to pick what works best for you. So it's good to read online about what the best devices are, but make sure you also think about how realistic is this for what you're going to use it for. As with any online or digital tool, practice caution. Be wary of the things that you post online. Be wary of the things that you write to an AI chatbot, and just practice caution with a lot of that stuff. If you're uncertain with how to proceed, get advice from others. Talk to people who have the device and read reviews. And as I've mentioned, where health is concerned, always confirm this information with a doctor. Always, always, always. And be very careful about the sorts of medical information you get from AI or from your wearable devices. That is all I have for you today. Thank you so much for joining and hanging tight. I'm going to end the recording in a second, and then we can do questions as well as our Echo giveaway. All right.